Hey everybody. All right, so let me go ahead and share my screen and we will get started on chapter 10. All right, so we're going to start talking about illness and then we're going to talk about the medical field. We're going to talk about different things that impact medical illness or how we think about it. And we're going to kind of talk about um, the medicalization of several things. We're going to talk about a wide variety of concepts. Now, there are a lot of these things that could be their own module, especially when we talk about healthcare costs, especially when we talk about healthcare coverage. I would love to do those. And there are some that I have lectures on for other classes. So if you're interested in that, we could probably make that happen. But please note that I cannot give all the social problems that we have, all the attention that I want to do. So I'm trying to make sure that we're getting them covered or touched on at least a little bit. All right. So when we talk about illness or we talk about what defines sickness or disability, even, it's not just biology, right? It's culturally defined, depending on, and the book uses the picture of the young child that definitely has some kind of ailment on his face. And I am not comfortable using that kiddo's picture just because I don't know if that kiddo had any consent, could even possibly consent, and or even knew that they were being photographed. So I have there's a whole lot of ethical concerns there for me. But the point behind his conversation surrounding that photo in the book was really that to that culture, to that group, that was a normal. So that wasn't something that was necessarily deemed as different or deemed as an illness or deemed as an ailment because so many people in the group had this as part of their everyday life, right? And so because of this, we think about what we consider to be ailments and what we don't consider to be ailments. And even in the US, we have multiple things that have changed over time, right? What we consider mental illness, what we consider to be culturally healthy, or what we consider to be even like the ailments that we face are radically different depending on the culture, depending on the ecology, depending on the environment, depending on the jobs, depending on what people are doing in their lives as recreation. All of these things impact essentially health and medicine and ailment. Okay. Also, as industrialization started to happen, we changed our way of life. We changed the way we did jobs. We changed the way we the products that we put in there, the things that we ate, the water that we drank changed, right? All of these things have massive changes and have pros and cons for health, and we'll kind of get into that as we talk about some of these things. You also have changing ideas of health and illness because a lot of times doctors get to define what is considered wrong or medically an ailment, right? Or a disability or what have you. So, like, for example, pregnant women are considered ill if their baby isn't delivered within 24 hours of after their water break. Now, I can personally attest to this. My first kiddo was born 41 hours after my water broke. It was a struggle to convince the individuals that we did the medical team that we did not need to be to induce or not to induce that we did not need to have a C-section, right? Because there's a risk of infection. All that considered, both the baby and I, my youngest and I, were both running a fever by the time that my kiddo was born. Now, my kiddo ended up in the NICU. They were the largest baby they had seen in the NICU in like months, they said. Like, because she was an overall healthy kid. She just happened to be born with a fever. And so they had to do a monitoring for so long in order to make sure there was no infection there, that nothing else was of complication. Me, they were like, you'll be fine. Here, here's an aspirin. We'll move on. Um, and that's pretty much what happened, right? It turned out neither one of us had infections. We were both healthy and we went home and everything was fine. But the doctor got to decide that because we had those fevers, because my body was trying to make this happen, because that water had broke, and it had done so in a way that caused both of us to run a fever, even though our heart rates were fine, everything else was fine. That triggered a box that they essentially are taught in medical school that says this is something we need to look at. This is something that could be a concern. This is something that is now an ailment. This is different, right? And as we continue to study things and we continue to study, and even if you look at birthing as a whole through the medical process, we learned, we have medically had to learn a lot because those who were like giving babies were putting women to sleep. They were trying to induce labor, and they still do this, where when you're having a kiddo, you're not using gravity to help you. And so you're laying completely flat on your back and you're pushing essentially without the help of gravity, without the help of these natural processes that had been done for years. And so things like midwives get um, disconnected from the process or even looked down upon, even though, hi puppy. Sorry, my dog has decided she's going to join the lecture today. Um, and so they have decided to kind of forego some of those processes. And in doing that, they have created situations where they've had to essentially fall back on processes that were already being used prior to the medicalization of birthing. And that's kind of created a great example, right, of where doctors, predominantly male doctors, have gotten to decide when something's a problem or when something's not. If you're sleepy, you can lay down. All right. Another example of this is when black lung started happening, which was a disease that was affecting coal miners. And they were consistently talking about respiratory problems. They were consistently talking about coughing up very interestingly colored things. And all of this got ignored primarily by doctors as, well, you're just around, so it'll be fine. Or you're just around these kinds of things, you'll be fine. And what ended up happening is this having really long-term impacts on their health and really long-term implications for a large portion of people who had worked in mining. Another example of this dynamic where certain people have the power to create ideal images or create what is healthy and what is not is the decision to decide what is the right BMI for a certain person. Specifically, you see this a lot in women, but there's a growing dedication to career centered around nutrition, around fitness, around weight loss. And all of those things include a large amount of fat shaming, a large amount of discrediting of a variety of different body styles, of different body types, different needs people might have for those genetic variations, etc. So instead of talking about particular kinds of concerning life decisions, they really focus in on weight a lot. They focus in a lot on, well, you can still have all those things that may not be healthy for you, but we're going to also let you do that and be skinny because that makes you healthy. If you're skinny, you're healthy. And that disconnect doesn't work, right? Like it's not factual. And it also creates a lot of shame and unhealthy habits when it's associated to lifestyle choices. And we'll get into that some more again as we move forward. We're going to get into a little bit how environment and disease on a global level are contained, and we're going to talk about that as we talk about the HIV/AIDS epidemic across the country. I don't think it's an epidemic anymore. It might be, but and we're going to talk about how changes environment impact diseases and health in general. So we're going to talk about things like wastewater treatment facilities and how that impacted health and with infectious diseases. We're going to talk about hygiene in general. We're going to talk about how environmental degradation, especially in another chapter, impacts health. And we're going to talk about that a little bit in this one too. And then lifestyle, the major cause of the three major, let's try that again. Major cause of illness and death is lifestyle choices. So that discontinuing of physical activity, those the way in which we McDonaldize, I don't know how to say that word exactly. But the way in which we've created a food system that is based on fast, it's based on a lot of salt, it's based on a lot of preservatives, it's based on a lot of pumped in chemicals and things to keep things fresh, to keep things ripe through the manufacturing process, through the process of getting it to here from wherever it's coming from, especially when things are out of season. And keeping it long enough to be pretty on the grocery store shelf for us to pick up. And so we're going to talk about how that impacts essentially your life and health. Many components impact health, but again, lack of exercise, overeating, smoking, alcohol, and unsafe sexual behavior are things that are at the top of that list. So medical error talks again about, I'm not even going to attempt that word, but essentially what that word means is medical error that harms patients done by any kind of medical practitioner or within a medical facility. Okay. And 400,000 Americans die annually due to these kinds of errors, and they're more common. Something that was said to me a lot when I was growing up was that even those who made C's and D's in med school are still doctors. And that's not to say that they don't go through an extensive amount of training, an extensive amount of things, but in order to be able to do their jobs, especially those who are having jobs that are like surgeons and things of that nature. But that's also not to say that they're not human too when they don't make error and those errors don't have consequences. And in this case, that would be considered the third leading cause of death in this country if it was considered, if it was something that was considered when we talk about life expectancy, and it's not. And when we get into this, we need to talk about essentially what is considered malpractice, whose concerns and errors, concerns about errors get pushed under the rug, primarily women, especially primarily women of color, when things have, when people don't get listened to and they wait too long, and those waiting too long gets, has consequences that lead to severe medical like ailments or death. A lot of times that's not considered malpractice. That's just something that's considered overlooked, right? It might be considered an error, but it's not malpractice. And so even though that person might have been complaining about these things moving forward, depending on, especially after birth, when it comes to maternal morbidity, you see an exceptional amount of women of color dying post birth due to not being listened to when they are in any kind of medical crisis, because they're just like, oh, well, you're in pain. Well, you just had a baby, so of course you're in pain. You just don't understand your own body. Those kind of discrediting things have led to a lot of death that could have been prevented with a little bit of investigation. And then again, who decides the medical ethics? So who gets to be on the medical ethics review boards? Who gets to decide whether these errors are worth any kind of consequence, or if those lives lost could have been prevented? And a lot of those are done by lawyers for the hospital, are done by ethics teams of other doctors, are done by people who generally are going to attempt to side with the medical professional in most cases, right? And are there to back them up. Moving forward, medical costs. So again, we talked about this a little bit in chapter 12, but just the overwhelming amount of staggering increase that is medical health and healthcare and the cost of any kind of hospital stay. This is over here a diagram that was in the book talking about the difference between the 1970s and 2020 for a medical hospital stay. And I would guess this 2020 with that big asterisk is actually like that said it was the author's estimate. And my guess was that is because the pandemic's not really talked about in here, that when he was making these corrections or these latest additions, that pandemic hadn't really been enough of an impact to really see how much that was going to impact cost of hospital stays, medical health benefits, packages, cost, all of those things to offset the massive amount of people who were and continue to be hospitalized due to COVID-19. And again, there's just an explosion of medical costs 150 times higher than it did in 1960. That's ridiculous. No inflation can account for that in any capacity. That's just essentially the medical industrial complex deciding that it wants to make more money. And so it can, because we do not have the amount of policies in place to prevent those things from being that astronomical. Currently, $4 trillion in spending. And again, this was pre-pandemic. So you got to think about that in terms of the way in which prevention and state aid and vaccinations and education and all of these things and PPE, all of these things that became part of public health spending, getting thrown into that number is significantly more. But prior to that, and without the context of the pandemic, it was already exponential and it just got increasing. It just increased quite a bit post the pandemic and continues to. The growth exceeds the average of everyday inflation, like by a lot, right? I put that there because I want you to understand that yes, inflation has something to do with it. Yes, everything costs more than it did in 1960, but it doesn't have to cost that much more. That is a product of capitalism. It is not a product of natural market value. Okay. Medical care is not worth 150 times more than it was worth in 1960s. I can tell you that much right now. There are three primary reasons, and that's elderly population is growing, and so they can charge more for those services, and the amount of those services are more, and so that's going to increase the amount we spend on medical care in general. It's expensive technological advances. So again, you're going to see that the more we have these very nuanced care technologies, such as or in just machinery in general. So the surgical procedures that are now much less invasive, but require maybe a robotic arm or a machine of some sort in order to do the procedure. Those things cost different, are going to cost more as a machine than say the doctor's hand would have prior to that. But it allows them to do things that it would not have been able to do before. Now, again, the cost of the technology versus the extreme rise in cost is not necessarily correlated correctly, right? So that might be a cause of why some of the costs went up, but it doesn't correlate to the amount it went up, if that makes sense. All right. And then most of it falls down to capitalism and the for-profit industry that is the medical industry. Medicine is a for-profit business. It is a two-tier system. So by that we mean that it's a fee-for-service medical system that has led to essentially two tiers. So those who can afford good insurance have good care, and those who can't afford good insurance or any insurance for that matter, really avoiding care, not getting very good care, and or being on some kind of government governmental assistance that covers probably less and can cost more. They can charge more to the government than they can the average person, or the insurances that are divvied out by a business. So, the medicine for profit. We're going to talk a little bit about this, in particular about C-sections. There's an increase in C-sections for a variety of reasons, and that includes that there's profit in C-sections. That's a surgery. It's going to cost you more. It's going to require more of a hospital stay, which is going to cost you more. It's et cetera, et cetera. However, it also creates a convenience in that you can plan around when you need to, when you're going to be off, how long your recovery is going to be, et cetera, et cetera. It is technically a technology, just in the sense that this is something that has been done so many times now that there's a good ability to do that, and a wide variety of doctors that are capable of doing that. On top of that, technological advances will continue when it comes to that particular thing, because it is something that is a regular occurrence, right? C-sections are a regular occurrence. Birth is a regular occurrence still in this country. So it is something that you're going to continue to see medical research pour money into, to find better and more efficient technological processes. On top of that, it's also a preference for some women, as it allows not only that ability to schedule it, but it also provides, it also is a preference in the sense that it can also include a tummy tuck, or it could include some of the other procedures that can be correlated with these notions of what post-birth women are supposed to look like, and maintaining the beauty standard post-birth. And that's a whole nother lecture again in and of itself. But again, there's also some controversy in these trends, because cesareans do pose a risk to the mom. It is an unnecessary surgery in some cases. Hear my words. I had a C-section the second time, and it was due to a complication. I'm not saying that all cesareans are something that can be avoided, and I'm not saying that if you chose to have a cesarean, you chose the wrong thing, right? And that's part of it. Is there's this controversy over these trends, because in one way, we want women to have the right to choose their own birthing patterns. We want women to have the right to choose this. In other ways, not everyone has access to that choice, depending on your insurance provider. And in some ways, that medicalization of the birthing process is concerning as well, because it does put a risk on the woman that can be unnecessary. And it takes us away from procedures and practices of things like midwives and other things that are really helping women through a process that female bodies have been doing for an extended period of time, or anatomically female bodies anyway. All right. So, and that's kind of the conflict within that. On top of that, you have the US medical system is not self-correcting, right? So, and this is some of the things that you're going to get into when you talk about conflict theory and the medical care system, or the medical industrial complex. So the US medical system is not self-correcting. So by that, they mean that it's not going to correlate or correct itself when it starts costing too much. It's not something that's going to balance out, right? It's going to be, there's always going to be a need for medicine. There's always going to be a need to cure ailments. So there's not going to be this, we can just not go and get medical care if we want to protest, right? Like that's not an option for people. And so understanding that that idea of that invisible hand on the market, or the market's going to adjust itself, isn't possible when it comes to medication or the medical system in general. It also talks about how Medicaid developed specifically due to, again, the political power of those who are aging and needing medical care outside of, and medical coverage outside of the work environment, because they were no longer doing that, or had retired or et cetera. And also because Medicaid and Medicare was needed in the way of understanding that there are significant economic differences between marginalized populations, and those populations have a right to live and a right to medical care. This also, there's conflict between the interests of doctors and the interests of patients. So again, there's a disconnect between patients being heard, and what treatments are allotted to, and who is allowed to be a medical advocate for themselves, depending on a wide variety of identity factors and marginalization processes. There's continued discrimination when it comes to persons of color and trans persons, and anyone who has a religion other than Christianity. All of these things have massive amounts of documentation of severe discrimination within the medical field. Women in general are listened to less when it comes to ailments that they tried to talk to their doctors about, which causes more long-term situations. And again, we are also going to talk about unnecessary hysterectomies to generate profits. This is an example of where a marginalized population, say women, or those who have uteruses, and the performing of unnecessary hysterectomies has caused a lot of medical concern within that population, because it turns out your uterus is actually does more than just create, produce, and be part of your reproductive system. It also helps with your adrenal system, your endocrine system, and helps to regulate a large variety of processes in your body. And without such, those processes can get severely off balance and can cause a wide variety of consequences for that person. So it is something that has caused a lot of concern overall. Also, the sterilization of women in general has been something that has historically been part of this country and has created a lot of genocide and or eugenics and or a lot of very, very ugly processes that have rendered a lot of women without autonomy, without the ability to consent to procedures that have happened to their bodies. And again, I have lots of lectures that include things about that if you are interested in that, and or I can get you resources that can sum it up fairly quickly when it comes to time periods in history where that has been the case. All right, so life expectancy. It's mostly trending upward for the most part, right? We live longer now than we used to at other points in history. In the 1960s, the average person died before 50 years. Today, the life expectancy is about 76. For women, it's about 81. That was pre-pandemic. So those numbers have gone down just a hair. And that's just because with the large amount of the millions and millions of people that we have lost to the COVID-19 pandemic, that has caused a significant leveling off or of that increase that we're usually seeing in life expectancy, and or a decrease in life expectancy depending on the demographic. It definitely, life expectancy can be related to income, education, and race. So depending on how much marginalization you have, how much access and opportunity you have to economic prosperity and or to medical health care, preventative care, etc., all of those things are going to impact your life expectancy. And all of those things are impacted by where you are in your social positionality within the United States. So if you are a person of color in this country, you are consistently going to statistically make less and or be discriminated against within the medical industry, which is going to leave you seeking out medical care less. It's going to leave you with less access to medical care. It's going to leave you with less opportunities to garner medical care. And that connected is going to impact your life expectancy, right? And so where you are within that social hierarchy of all those things, and however many marginalizations you have, is going to then increase your chances that your life expectancy is going to be less than maybe others. Okay. Um, there were slight declines in 2015 and 2016, possibly due to deaths related to the opioid crisis, and that's kind of leveled out. However, again, during the pandemic, specifically during the pandemic periods in which years of 2020 and early 21, we saw a lot of opiate overdoses during the pandemic, and during those situations where there was an increase in loss of job and uh, decrease in social support networks being able to maintain their networking systems. And just resources went down as well. So that created again an uptick in um, deaths due to drug use and etc. All right. There's also, again, I've already talked about kind of the decreases during the pandemic. We're going to talk a little bit about infant mortality. Rates have declined significantly throughout the country. However, and this gives an example. In 1960, it was 26 deaths per every 1,000 births, which is astronomically high. Today, it's 5.8 deaths per 1,000 births, which is still astronomically high considering we are a well-off country that should be able to have much better prenatal and medical care to prevent some of that. All right. It used to be a measure of overall well-being in society. But the rate is higher in the US than most other countries that have the economic prosperity that we do as a country, or first world countries, if you want to label it that way, or those in the that make significant amounts of global decision-making practices. So the problem with this becomes it's higher in the US than other countries, primarily due to huge pockets in poverty and due to racial discrimination, and again, access to healthcare. So these things, and because we do not have any kind of universal healthcare system, or we don't have any kind of system that allows for prenatal care across the board, and for just overall welfare for women who are pregnant, including being able to know we're going to be able to take off work afterwards or what have you. There's economic disparities that create systems that puts a lot of stress on women in the United States as they start to kind of figure out what's going to happen after birth. And that stress can put a lot of can have a lot of negative impact on the baby. There's also, again, a lot of racial discrimination. And so a lot of women of color are not listened to when it comes to trying to voice concerns that they're experiencing during their pregnancy, which can increase rate of infant mortality. Just so you know, here is your map. I believe that's one of your questions in one of your assignments. Wink, wink, nudge, nudge. That shows kind of the countries that are doing way better than we are. Japan has the lowest rate of infant mortality, which is interesting. But also, I think they have a very good, if I remember correctly, they have a very good preventative care when it comes to the birthing process and pregnancy in general. All right, let's get into life expectancy part 2 real quick. I think, hold on, there we go. Life expectancy part 2. There's been a lot of historical changes in health problems, right? So the 10 leading causes for death make a social nature of the death apparent, right? So, and this comes down to in the 1900s, it was pneumonia, tuberculosis, diarrhea, heart disease, strokes, kidney diseases, right? Accidents, etc. So then you get over into now, you're going to see heart disease, cancer, lung disease, and again, you're going to see these differentials, because you see a lot of treatments for some of the things that are at the top of the list on the other side, but you're also going to see a significant portion of things that happen to people as they age, right? So cancer is the breakdown of cells. Though as cells continue to age, they're going to start to break down eventually. That is an eventuality for every living thing if it lives to a certain degree. Now that varies depending on who you are, and that also has some environmental factors as well. Um, However, it's something that if you're not living as long, like you weren't in the 1900s, you're not going to see cancer up there as high, because that life expectancy and that ability to get to a medical positionality where you might start getting to those age where your cells might be breaking down was significantly less, right? Um, and so again, talking about things in the way of preventable diseases, and prevention in general can really make severe differences between what are the leading causes of death um, at one point versus what they are at another point. And we're going to continue to see that, right? The more we get preventative care for things like heart disease, or even preventative care, and we learn the more ecological or environmental factors related to cancers, especially when it comes to degradation of water or degradation of soil and land, and toxins that go into our food making processes, we're going to be able to also kind of lessen or maybe prevent some of those particular settings that create our current um, leading causes of death. All right. So again, and that comes back to that death related things. And then you talk about the pandemic now, right? So we're talking about an illness that when we look at charts, at some point, there's going to be a couple of years where COVID's going to take the tops, or very near to the top when it comes to causes of death. And that is going to lead, and has led to vaccines and inoculations and better treatments in order to kind of lessen that, right? And that's an example of where we're going to have things pop up in history that we haven't come across yet. And while this global pandemic taught us a lot about infectious disease and how much we are a global network at this point, it's also a moment in time that we'll need to look back on as we continue to go through these biological processes, and as viruses continue to mutate and turn into other concerning situations. All right. All right. So I'm going to stop here. And then we'll get back into it and start working on some more of chapter 10 in the next lecture. But I want to make these a little shorter so that way, hopefully, they'll be easier to kind of attend with. So if you need anything, or if something doesn't make sense, or if there's a topic in here that you find very interesting and you want more resources on, please do not hesitate to reach out and we will work on getting those.